my name's Joyce Gibb, and this is part 2 in this series about iodine. So we talked previously about iodine and where you get it and the need for it, and basically it seems like the previous RDA amount was only what was necessary to prevent goiter. So iodine is also an antioxidant, an anti-inflammatory, and immune supportive properties. This may be true when you take daily doses of at least 3 milligrams a day. And so how much iodine do we need? And there's a case for higher iodine consumption. There was a study in women that with normal thyroid health, but they had breast pain. And when they took 6 milligrams of iodine daily for 6 months, 50% of them had reduction in breast pain as related to their menstrual cycles. So fibrocystic breast disease, iodine helps with that. Iodine lowers the risk in breast cancer. It's 4 times lower in women with good iodine levels. The mammary glands compete with thyroid for iodine. So when you look at normal breast tissue, 6.9 is what the iodine level is. And in abnormal breast tissue, they are deficient in 12.5 milligrams. So when you look at it, iodine, the intake of iodine at 50 milligrams a day would decrease the oxidative burden and DNA damage. So for breast tissue. So some people are actually using iodine with breast cancer treatments. So iodine in cancer, less iodine shows increased tumor growth. Iodine deficiency can cause mutations, DNA mutations. It can reduce mortality, infant mortality with good iodine levels. It reduces spontaneous abortion. It increases intelligence, so make sure you get enough iodine. Vegan and vegetarian, 1/4 of the vegetarians and 80% of the vegans suffer from iodine deficiency. The iodine excretion value below 100 micrograms per liter compared to 9% in the persons on mixed nutrition. So what are some symptoms? You think, what are some symptoms of iodine deficiency? Dry mouth, inability to produce saliva, the salivary glands, dry skin and lack of sweating, fatigue, irregular heavy periods, memory problems, muscle cramps, nodules, scar tissue, pain, fibrosis, fibromyalgia, reduced alertness, and lowered IQ. And so you think about, wow, those go with thyroid, they go with dementia, they go with everything. And that's the priority is iodine affects so many other bodily tissues. So in fibromyalgia, they had, it took 3 to 4 years with iodine replacement in one study to reduce the pain by 50 to 80%. So then you talk about what do you need for iodine? So when you look at thyroid labs, you look at TSH, thyroid stimulating hormone, you look at T4 and T3. So here are the chemical structures. So you can see right here, T4 has 4 iodine components on the structure. And on this side, T3 has 3 iodine components. So that's why they say try, the treatment for T3 is triiodothyronine. Okay, so that's 3 iodines. So T3 hormones has 3 atoms of iodine, and T4 has 4 atoms of iodine. You have to convert T4 to T3 for the active forms. And we've talked about that before. So 12% of the United States has a thyroid conditions associated with, poor thyroid function. When you have thyroid antibodies, TPO and thyroglobulin antibodies, that is greatly tied to reduced iodine. Women are 8 times more likely than men to have thyroid problems. Then, we look at testing. There's different ways to look at testing. They have an iodine excretion test in the urine, but it also, you lose iodine in your sweat and your feces. So really, there's not any really good test to do. We used to recommend that patch test where you use povidone, the brown stuff, iodine on your forearm, But the bad thing about that is it's not really very accurate that they've shown with testing. So there's a loading test for iodine. There's a test you can check for iodine in the serum, but you do clear iodine through the urine, through the feces, and the sweat. So there's really not any really good way to do it. But when you test for iodine and you look at some labs, that's a better way to see if you're potentially deficient in iodine. So you do a thyroid panel for iodine deficiency. And here's some things that we can check. What happens with the thyroid levels? If you have iodine deficiency, you may have a high TSH, which happens after menopause too. You can have a high thyroglobulin. You can have a low T4, which is total and free, and a low T3. And a lot of the chiropractors do muscle testing. That's another way to do that. So when you look at the big picture, most health issues and challenges are related to pathogens and toxicity. And so toxins reduce your ability to absorb iodine. So when I see somebody that has a lot of issues with their thyroid, the best thing to do is do a detoxification program. And I use Cellcore Biosciences as that detoxification program. I like their products. Their products really work. And so if you'd like to go through detoxification program, I'd be glad to show you that whole process, because we're exposed to 180, chemicals every day before we leave the house. So you just have to look at the whole picture. But come see me. I'd love to help you with your journey to renewing your good health. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.